You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, big topic, no more dentures. According to my first guest, you can get a full set of teeth, a fixed set of teeth, in just a few appointments. With us, we have an expert on the topic of dental implants, Dr. Burr Bakke. Dr. Bakke, welcome to the program.
Thanks, Randy. Great to be here.
All right, now, you have some pretty dramatic photos, so I hope people stick around for that because we're going to show a few of those. Now, before we get into today's topic, tell me a little bit about your practice. I mean, who's your typical patient and what are the different procedures you do? And I understand you also work together with your wife that's a dentist.
Yes, my wife was actually the owner of the practice and started it. She's my boss in more ways than one.
All right.
Our typical patient is, we live in Sarasota, so they're usually elderly.
Right.
They're in their 70s, 80 years old. Most of my patients have dentures, and we're trying to get them out of dentures into fixed teeth. My wife sees patients with teeth because she does the restorative side of our practice. So we see typically 30-year-olds on up. We don't see children. And
now with dental implants, you say some of the patients that are, come in with dentures and they want a fixed set of teeth are how old?
Anywhere from 70. The oldest person I did was 92.
So you're not too old at 92?
You're never too old. Never too old.
But why would a 90-year-old want dental implants?
Well, if you think about our society these days, we're extremely social. People want to get out, they want to see everybody, they want to eat better, but to do that, you have to have teeth.
Okay.
These individuals that have dentures, as you lose all the bone, your dentures don't fit anymore. And it's one of the reasons I got into doing implants. I felt so bad for these people. My father was one of them. He wore dentures. He got to where he couldn't wear them. We'd go to dinner and he's not wearing his teeth. And he has to eat mushy food. His nutrition's horrible. Consequently, he passed away earlier. I see this a lot. I feel so bad about it, I got into doing implants. Because with dental implants, you can stop that. The teeth fit, they don't move around, you can eat 1,000,000 times better, and most importantly, you can smile.
Is your thought, though, that the future of dentistry, the dentures as we know them, will be gone? They'll all be secured by maybe dental implants?
I can only hope they're gone. I hope they're gone. Everyone in my practice, I try and steer them away from dentures. Because people come in, and I'll show you some photos later, and their options are dentures. You can have dentures. To me, it's almost malpractice if you have dentures without implants. You can do fixed teeth, you can do dentures that clip onto implants that stay stable. It's night and day from dentures.
Really? Really?
Night and day.
Now, is there such thing as a happy denture wear?
Not that I know of.
Really?
Not one.
Because I know people with dentures, they don't complain.
Yes, but you're not the dentist either.
Okay, good point.
Nobody's going to bring out their dentures and goes, man, I hate these. They'll tell me all day long.
All right.
And that's the reason they do. They come into my office and they go, I can't, mostly the lowers. They kind of get by with the uppers, but it's the lowers they hate. And you can fix that problem. A minimum of 2 implants, and that works okay.
So you can give them 2 implants, something to secure it.
Right.
No more adhesive.
Correct.
Okay.
I mean, they're tired of putting the glues in.
All right.
With 2 implants, you can put in the denture. Now, 2's not ideal. I'd rather see 4, because with 4, you open up your options. Again, you can put a denture on 4 implants, snap it in, snap it out, or you can have actually fixed teeth. They can go in on
a full arch of teeth.
A full arch of teeth on 4 implants now.
I have a lot of questions about options for denture wearers and the process, and I'm going to get to the photos. But at the top of the show, I called you an expert, but you're one of the people that actually are. I mean, you've trained dentists all over the world how to do dental implants. Is that correct?
Yes.
Elaborate on that.
Well, my wife and I both. In fact, we actually met at LVI, Las Vegas Institute. Now, Las Vegas Institute is a postgraduate facility for dentists. They bring patients, and we were actually instructors there for almost 10 years. And we've kind of retired now from it.
Is that true, though? Dentists from all over the world go there to learn?
All over the world.
Is that right? Okay.
That's exactly right. I've had Canada, there's a lot of Canadians that come down, Australia, Japan, China. We've taught them from everywhere, thousands of dentists, and brought in thousands of patients. And that's what we've trained them on.
So getting dental implants, by the way?
Yes.
I mean, you guys say it doesn't really hurt, or it's virtually painless?
Correct.
Because it seems very painful.
Not anymore.
No?
Not anymore. Used to be. Years ago it was. It was a process.
What's changed? I mean, doing some research, what used to take you guys, let's say 9 months, now can happen in even 1 day or a visit or 2.
Yes.
So what's happened?
Technology. What happened was technology. We now have CAT scans. We've had a dental CAT scan in our office for over 7 years now. We had one of the first ones in the country. A CAT scan gives us a 3-dimensional model of the patient's jaw, teeth, head.
Okay.
We can use that, build models from that without ever even touching the patient, so that when we actually go into the mouth, there's no guesswork. It's all done. We use guides to place the implants now through just a little small incision in the gums. What hurts in dentistry is if you have to open up the gum tissue.
Interesting.
That's where the pain comes and the swelling and all that. But
So a 90-year-old, you mentioned a 92-year-old getting
Yes.
dental implants. They don't complain about pain?
No, he took 2 aspirin.
Why aren't they all doing it? Why aren't they getting maybe 2 implants to secure a denture in?
A lot of them don't know about the technology. They don't know what's available today. You think about it, most people that wear dentures, they don't have to go to a dentist anymore. They don't necessarily have teeth. And unless it breaks, they really don't go back because they're used to wearing the glues. They put up with it. Truth be told, if they had dentures and they did them correctly, every 2 to 3 years minimum, they would be in there to have them relined or remade.
Okay.
Because the bone goes away and they don't fit well. With implants, you stop all that process. The bone quits going away. You have good, healthy gums around those implants because they can take care of them easy. And you can take dentures in and out on implants, or now you can have fixed teeth.
What's the biggest benefit? A denture wearer switches over to something secured or a fixed set of teeth with implants. What's the biggest benefit? I mean, what do they tell you?
They can eat.
Okay.
Yeah, there's a couple of things. One, if you do it on top, you get rid of the roof of the mouth plastic. Well, that opens up 90% of your taste buds. They couldn't taste before. They oversalt everything. In fact, the biggest comment I hear, you gave me these teeth, doc, everything's salty now. I tell them, put away the salt shaker for a little while.
I mean, your photos, you take regular people, now you make them look like celebrities. And if you stick around for these photos, I'm seriously, it's not an exaggeration. I mean, these people look like $1 million.
They do.
Show some of the photos. Let's start with one of these photos.
All right, Randy, here's a credible lady. She comes into my office. Look at her smile. Yep. With her smile, she's got worn teeth in the very front. She's only got 6 or 7 on top. She's got gaps on the side you can see. She does smile, but it's not a big smile. It's not a happy smile. So here you have this lady with the issues I just talked about. But in addition, what you don't see is she had gum disease. There was very little bone around those teeth anymore. They were infected, they were inflamed. She had a chronic infection in her body because it's not just limited to her teeth, it does go through your body. Those teeth had to come out. So then you have 2 options. You can have dentures, which for all the bad reasons I just told you, or you can have fixed teeth. She chose fixed teeth.
All right.
So we take her in one sitting to this.
Nice.
Now you go from a much bigger smile, and these are the temporaries, by the way. This is what she gets the first day. This is her road test teeth that I call them, because she gets to wear these for about 3 months. During that time, we're playing with them, we're looking at the cosmetics, we're changing them, we're adjusting them. We're getting to where she absolutely loves the look, the feel, and everything else about them.
Now, you say they have to get used to smiling again.
Absolutely.
What do you mean by that?
Well, if you look at her picture, before, forced smile. It's forced. You can barely see her upper lip. It's flat across. There's no bow to it. And you look at this. Now, she is forcing this a little bit, but as she gets used to these, I didn't get a new photo. If I had, you would have seen after 3 months. The smile increases. The actual upper lip is actually more plump and rolled out.
And they look like real teeth.
Absolutely.
Do they feel like real teeth? I mean,
they're as close to natural teeth as I can get.
So that's fixed. That's inner mouth doesn't come in and out?
They do not come out at all. They can eat anything they want with these fixed teeth. They can have steak. They can have raw vegetables. I mean, most adult patients don't get enough fiber, let alone the elderly with dentures. They can't chew it. Fixed teeth, they can. The forces you generate on your teeth, on their natural set of teeth, are hundreds of pounds in the front to 1,000 pounds in the back. If you have dentures, you're like 10 or 12 pounds in the front, maybe 50 in the back, because they give. When you put in implants, it's 400 to 500 pounds of force in the front and 4,000 in the back. Implants don't move, they don't give.
Okay, let's take a few more for the sake of time. What else are we looking at here? Very interesting.
This is a great one. Another really great guy.
Wow.
This individual came in very ill.
Okay.
Chronic infection, mostly from his mouth, as you can see.
Does that hurt to eat?
Absolutely. Like he was in pain constantly.
Is that rare? I mean, that's got to be rare.
Not my practice. I see it every day.
But a guy like this, I mean, like you say, this chronic infection, can the gums be too bad to qualify for dental implants?
Absolutely not. Once you get rid of the source of the infection, which are the teeth, gums clear up. They look beautiful and healthy again.
Interesting.
Yep.
So what'd you do for him?
Well, what we did is he wanted fixed teeth. So it was a fairly simple process. We removed all of his teeth. We placed 6 implants on top, 4 on the bottom, and fixed teeth in.
So 4 implants on the bottom and they get a full arch of teeth.
Yes.
Interesting.
Yep. And we put the 6 on top and a full arch of teeth on top. He couldn't smile before. He never would smile. His lips stayed together. You never saw his teeth. Now he's starting to smile more and more. And he told me,
looks like a real friendly guy in the after.
He's so nice. The nicest human being you'd ever really want to meet. He's so nice. He's learning to smile again. And he told me that. He said, because it's been about 3 months now, and we still get him back and forth to see him and talk to him. And he's like, I'm learning to smile now.
Because you could see he could look like a mean guy if he wasn't smiling.
Oh, yeah.
Right there.
Yeah. But I've got a lot of patients like him.
Okay.
I mean, this patient came into me. He's got 1 or 2 teeth left on top, 3 or 4 on the bottom. That's his smile. He's not showing us teeth. He doesn't have any. So he's not going to. Great guy. He's in real estate. He has to talk for a living. He's an auctioneer. He's a really good auctioneer, by the way.
Okay.
But he needed some teeth. He needed a smile. You can see the before. He's got no teeth. He can't. He couldn't chew. He couldn't eat. So for him, what we had to do, again, his teeth that he had were actually healthy, but the final result, are those teeth worth saving? 2 or 3 teeth? If they're going to get in the way of the final result, we ended up taking those out. Because to get him where he wanted to go, we had to look at everything. So we ended up taking his teeth out. We placed fixed teeth in him. That took him to a beautiful smile. He could talk.
It's like a completely different guy.
Yeah. He looks 20 years younger.
It's true. It's true.
Best part about this is look at perceptions.
Okay.
Look at his before picture. He's not smiling. What kind of guy do you think he is?
Yeah.
You know, he may be an old guy, maybe unhappy, doesn't look that great, you know, maybe a bum on the street even.
Yeah.
Now look at his smile. Somebody with teeth. Teeth are our focal point, believe it or not.
Okay.
When somebody's walking up to you, if he's not smiling, what do you think of that person? I mean, look at supermodels. That's the greatest thing.
Yeah.
They all smile. Beautiful teeth.
Yeah.
If they don't have beautiful teeth, they're probably not a supermodel.
Yeah.
If you saw a bum on the side of the road with a great big smile, beautiful white teeth.
You wouldn't believe he's a bum.
Yeah. Not at all.
He's a secret reporter.
Yeah.
Yeah, that's a good point because, you know, if you saw this guy walking down the street, he almost looks more intelligent or more sophisticated in the after.
Yeah.
And also because that's a fixed set of teeth, okay? And I always feel like I could spot dentures walking down the street.
You can.
Okay?
Yeah.
But this, I mean, there's a cosmetic aspect to this.
Absolutely.
It's like cosmetic dentistry.
These are absolutely made, when we go, like I said, I put a test drive set of teeth in. They're the temporary teeth we put in the day they get them. They have to wear them for about 3 months, and during that time we're tweaking them, playing with them, adjusting them, making them look exactly like they want them to look.
Okay.
With our guidance, because there's certain parameters. And I may think they look better this way, he may not like that. So we make them like he wants them, or she wants them to look in the end. Because we did all the cosmetic work on him, we made him look perfect. He is an auctioneer, he is a real estate broker. I can't tell you how much better he's done. He's getting more gigs, if you will, to do auctioneering. And he really is a great auctioneer. I actually heard him one time. We went to his auction.
Okay.
He's doing well in real estate despite the market.
So their personality comes out.
Absolutely.
In a way.
Absolutely. On women, and I'll show you some difference on
Yeah,
women.
let's take a look at some women. And by the way, do more women come in than men?
I see a lot more women because women tend to come into dentistry first.
Okay.
The husbands always seem to be, well, honey, you go and test him out, and I'll come later if he's any good. And that's kind of what I've found over the years.
Okay.
It's not that they don't need it any less. They need it probably more. Most men, and some of these men, I'll show you, they're in businesses, and they run their businesses, and they're always busy. They don't have time or think they don't have time. Women tend to have more time.
Okay.
Here's a woman. Teeth look pretty good. Problem is she had gum disease. It was so bad that this is actually a one-piece fixed bridge on top. All the teeth are fused together. Okay. But all this bridge is sitting on was only 4 or 5 teeth. The whole bridge, including the teeth and the roots, came out in my hand, which is what brought her in. We didn't have a lot of option. Basically, she had a choice, either fixed teeth or dentures.
Okay.
She didn't want dentures.
All right.
Most women don't. Her bite had collapsed, which you can tell in her photos. Her lips are very, very thin. There's no support for her lips. So when in this process, we have to rebuild that out. So that's part of the aesthetic side of that we work on over several months. Once those teeth came out, The gums all healed up beautifully well. Nice, pink, healthy. The implants were in. We put in 6 implants on her on top, and we put in fixed teeth. The after photo shows her new teeth.
Very nice.
It's all fixed porcelain.
Very nice.
Her lips are a little bit plumper. She had pretty thin lips anyway. But the dramatic part of this is, which we're really going to fix, is her lower teeth. Her lower teeth are healthy. Because we made the top ideal, she wants her lower teeth fixed now.
Okay.
When she does that, we're going to restore her bite perfectly. In doing that, we're going to open it up. We're going to give her a non-surgical facelift.
Okay.
Her face will look thinner, longer. She'll be $1 million by then. So let me show you a younger patient, combination kind of case that we did.
Wow.
She came in, had a disorder that there was no enamel on her teeth. They wear down very rapidly. Basically, you can see that her gums in the back are hitting top and bottom. The back teeth are flat. They're not even there. So we had to take out the back teeth. She's too young for dentures. I mean, at 16 years old, you're not going to wear dentures.
Wow.
So we placed implants. We opened her bite up.
Oh, my goodness.
How's that? You can see what a difference a smile is. And in a 16-year-old girl, that's huge. So here I want you to look at the before and after.
Okay.
What difference does that make? You have this beautiful smile. Great teeth, nice, soft smile, very feminine look because she's a female. Men, obviously, we make them a little differently. How's that going to affect her life? 16 years old. So you look in the future. She goes for a job interview. Here, not so confident. Here, extremely confident.
Yes.
She can smile with confidence. The smile is a focal point of anybody's face. It's what we
is
all look at.
You're a dentist. Of course you think
Absolutely.
How important is the smile?
It's the
For
number one thing.
70,
Doesn't
75.
matter. Doesn't matter. It's like I said, these people that are older, that wear dentures, that can't wear the dentures, they take them out to chew and eat. They don't stay in. They don't go out of their rooms. Go to any nursing home. They're all held up in their rooms. The ones that have teeth and are smiling and are out having fun, look at them all. My grandfather had his teeth his whole life. He was a cut-up his whole life.
Okay. Tell me about the options. Okay, so for the denture wearers, what are the options for the denture wearers? So somebody's watching this, they've been in dentures 20 years. Is that too late?
No, never too late.
Okay, so they
Never
go
too
in, what
late.
are their options?
Somebody comes in and you're wearing dentures. They're actually pretty easy to diagnose. You have 2 choices. You can still have dentures, just a much smaller denture on a couple of implants. At least it will stay in. You don't need the glue, and your biting pressure and force will increase. So you can eat and be social.
So like 2 implants, snap in,
2. I
snap
prefer
out.
more than 2, but
Okay.
yes, you can do a minimum of 2. They snap in, they snap out. You can clean them easily. Those are the great things about it. The downside is it's still a plastic denture. Or with just a couple of more implants, 4 on the bottom, 4 on top actually. I prefer 6, but you can do it with 4. You can have fixed teeth. You don't take them out. You don't have to worry about them.
So a denture wearer could go in 4 implants and this whole teeth in a day or teeth in a few visits. I mean, that's real.
It's totally real. Totally real.
And they just don't know it exists.
They don't know
Or they
it
don't
exists.
believe it? Do you think they don't believe it? My mother, I told you, 73. She goes, Randy, because I interviewed a few of you guys before, and she said, my medical doctor said I'm too old for dental implants.
Nobody's too old.
Okay.
Nobody is too
But does
old.
that come up? Do you think they think they're too old
Absolutely.
sometimes? 'Cause
I think they
73
do.
is young.
Yeah. Their normal fears are, does it really work? I mean, I hear you
Yeah.
guys on TV. Does it really work? It absolutely works. You can actually talk to a lot of our patients. We talk to them. They say, yes, if you have somebody that wants to talk to us, please have them call. And we do. They talk to a lot of our patients about it before they go through it.
So you call it all on 4. That's just a full arch of teeth on 4 implants.
Yes.
And that's strong enough to eat and chew and
Absolutely. With
how
the
long
newest
could they last?
technologies.
How long can they last?
I say indefinitely. If you take care of them,
Like your regular teeth.
Like your regular teeth. If you take care of them, they'll last you indefinitely.
Okay. The indenture wearers, what are their fears? I mean, what do they want to know when they walk in your door? What are the standard questions they all ask you?
The biggest one is pain. Is this going to really hurt me? The answer is no. It's very mild. Like I said, I have a lot of patients. We've put in many, many implants, and they take a couple of aspirin. We put you on antibiotics. We give you usually Motrin, Advil, or Tylenol for about 4 or 5 days, just in case you need it. Basically, you don't. That's their biggest question. Then they want to know, do I have to be awake during this?
That's a good question.
It's a great question. 98% of my patients take a little bitty pill and they're asleep. They're awake enough where I can go open up, and they open. But the beauty of the pill is they don't remember anything that day. The kind of joke about the pill part of it is, which we've learned, is, and I had a patient do this, which is why I've learned this. One, you cannot drive. That's always been our thing. Somebody has to drive you and take you home, and hide your car keys. Because you'll be awake and you'll think, I'm good, and you won't remember where you are. The second thing is we make you take away your credit cards. I had a lady that 3 weeks after our surgery had Home Shopping Network show up on her doorstep because she got on TV, she bought all this stuff, and had no recollection she did it.
Is that right? Okay.
So the nice little pill has got some great things, but one little side effect is you don't use your credit cards.
So don't let fear or age keep you from getting a fixed set of teeth.
Correct.
In just a few appointments.
In just a few appointments.
Okay. And by the way, let me get this right. You do it all under one roof. I mean,
Yes.
how it's normally done, and correct me if I'm wrong, you go to one person, the surgeon, then the other person, which is the restorative dentist, at your place, and then they go to the imaging center somewhere else.
Right.
Is that true? Like maybe 3 places?
3 or 4. Sometimes you have to go see a periodontist also. Check your gums out first.
Okay.
The beauty of what we do in our office.
So you do both?
We do it all there.
Okay. Okay.
The beauty of it is you and I, let's say you came in to see me with
Yeah.
dentures, and you and I are going to make you a set. You and I determine, first of all, what do you want? Where do you want to be in the end? And then we backtrack from there. But
Okay.
only you and I know that. But you and I will get to there. But if I have to send you over here and over there and over here, and
You
then
lose
back
steam
to me,
maybe a little
we
bit.
lose everything.
Because nobody likes to go to the dentist, right?
No, they don't. It's getting more fun because they take a little blue pill and they don't remember, but nobody likes going.
For people just tuning in, okay, so your office is where? Your center is where?
Sarasota, Florida.
Okay. And you teach dentists all over the world, you've taught how to do dental implants.
Yes,
And you've done thousands of cases?
yes.
Is that right? Are you that much better now than you were? I guess that's an obvious question, but
I like to get better every day. I still don't believe I've done my best because it's always changing and we're always striving. That's why we call this world-class dentistry.
okay.
We're always striving to get better.
So no more dentures.
If I could get rid of dentures in this world, it would be a great thing.
And what's the process like? Okay, so a denture wearer is watching this. In a perfect world, okay, 75 years old, you say in Sarasota, average age a little older, 75 years old. They go in, if everything works out, how soon can somebody watching this have a fixed set of teeth in their mouth that don't come out?
24 hours.
Is that right?
Yes. In 24 hours with a denture wearer, we could place the implants and have fixed teeth the next day.
Is that right?
Yeah,
What
all
do you
within
call
20
that, by the way?
I call it 24-hour teeth.
24-hour teeth?
Yes.
So it's not a gimmick or a slogan?
No, no. Nobel Biocare, which is the #1 leading implant
Okay.
company out there, they've coined the phrase all on 4. It's a trademark phrase that
That's
they
4
use.
implants for
4 implants
a
for
fixed set of
teeth.
teeth.
Yeah.
What do you like most about what you do? I mean, what's the most gratifying thing about what you do?
Seeing these patients smile, that they can eat, that they can be social, that they no longer have dentures. That's just incredible.
Do they now this smile? Do they get compliments on their smile? I mean, when they come back, do they give you their stories?
All the time.
Like what? Like what? What are they?
Well, you know, they always hear, my goal is when I make these is that you really can't tell, unless they're really awful teeth before. I want to make them so that you just can't tell, but most people get looked at and they go, did you lose weight?
Is that right?
Did you change your hair? Unless they're bald-headed. What did you do? And that's it. That's kind of what my goal is. Now, a lot of them don't care, and they go, man, look at my new teeth. But they're happy. They're smiling. Their whole outlook on life has changed.
And so the denture wearers, you said earlier in the show, and let's say there's thousands in your town. The reason they're not all doing it is because they don't go to the dentist anymore. Nobody's suggesting they do it.
They don't go to the
Is that your
dentist.
take on it?
Yes.
And they're afraid of pain.
They're afraid of pain. They don't hear about it. They only go to the dentist if it breaks.
If they knew the benefits, would you say they would be lined up
I bet, yes.
at your office? You know, I like that story where you say that if there was a try-in period
Yes.
for denture wearers. Elaborate on that. Tell that story.
Well, if they had if you could test drive a car, you never take it back. I mean, that's
Okay.
why the car dealers do it. But if you could actually get rid of your denture and have fixed teeth
just for the weekend.
just for the weekend, you'd be like, no, you can't have them back. Because you can chew, you can eat, you can smile again. And no glues, no taking them out and cleaning them, No broken, cracked teeth anymore. It's night and day. It's light years difference.
So we're out of time, but final message. Somebody watching this, and maybe they're still skeptical, the denture wear, all right? What's their first move?
Give us a call. We have a free consultation. We'll take a CAT scan, and we'll sit down together, and we'll look at the CAT scan. It looks at the bone you have, the teeth you have, and we can talk about it.
Do you ever get those cases where, my father was one of these people, that they were told not enough bone and that you're able to do it?
Absolutely.
Does that ever come up?
Every day.
Every day?
Yep. Most people, if they've heard about implants, they go in, especially if they're denture wearers, they were told, you don't have enough bone without some major bone grafting. I still do a lot of major bone grafting for certain situations. But for the all-on-4 technique, and the reason it was designed 20, 30 years ago, was to get away from the bone grafting. The newer implants.
Is that right?
Yeah, that was the original thing.
So if you're if you're 75 years old and you've been in denture since you were 40, chances are
you still have enough bone to place implants.
Is that right?
Yep.
Now, what if you're on, medications like a little bit of osteoporosis or those kind of things? Type 2 diabetes.
You just have to heal longer.
Okay.
That's the biggest thing. We take some of those, all those things are considerations, obviously. Osteoporosis is one. Major osteoporosis, you may not be a candidate. Diabetics.
Well, tell me this. How often do you have to turn people away where you say you're not candidates?
I haven't yet.
You haven't yet?
No.
I had a guy one time on my program say, if you're healthy enough to walk into my office, you might be a candidate for the procedure. Do you feel somewhat that way? Obviously, if you have a disease or you're in a current treatment, probably not a candidate. But
yes.
A lot of people self-diagnosing that it can't be done, and you're saying it can.
It can, yes.
All right. Well, I want to thank you for coming to the show. Very interesting. Good stuff.
Thank you.
Good stuff. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again online, visit our website at wellnesshour.com and just look up Dr. Bakke. For now, I wish you good health.